It's one of those things that it has to be in your heart to do it. It's not something that you do for mercenary reasons. You do it because you think your legacy of when you go on is to leave something better than when you found it. I am Arthur Collins. I always wanted to be in public service, and my college career was designed to work in a public institution of some sort. And I retired at about 67, and at that point in time, some folks who were friends of mine said, "Hey, we got something for you to do in retirement. How about joining the Secours board?" And I did. I was on the board for 8 years, 3 as chairman. Well, I think everybody ought to have adequate health care available to them. When I moved out here, this was virgin territory. There were nothing but cornfields and soybean fields around here. And Secours was the first one to put a stake in the ground and said, "We're here to serve this community." And they did. Emergency room, outpatient hospital, that sort of thing. This is a growing community, a needing community. We're building a standalone 24/7 hospital. Right now, if you need overnight care or that sort of thing, you have to get ambulanced or somehow down to Maryview, which is can be a challenging trip at times. I know that because my wife had to make that trip in the middle of the night. Everything's fine. They took care of her tremendously, so she's fine. But the inconvenience of putting somebody in the back of an ambulance in the middle of the night and have to drive them some distance, by having the hospital here, we can alleviate that problem. I think people understand that health care is important, having compassionate and available health care. And I think that to the extent that Secours meets that challenge, we're all benefiting from it.